In this video, I'm going to talk about singers and singing and how voice therapy can support singers through vocal times of crisis and vocal changes that happen sometimes with a singer's voice. I'm contacted very often by people who say they're struggling with their singing voice and that it's becoming increasingly more unreliable or getting more tired more quickly, or they can't reach notes. These are all typical things that can happen to singers. And one of the biggest challenges for me as a therapist working with singers is the fact that people have to keep singing, often keep working while they're trying to get their voice better. And this is the thing that I find the hardest when I'm working with singers. So, of course, most professional singers and many amateur singers as well earn all of their money, or some of their money at least, from performing. And so getting gigs is one thing, and trying not to lose your gigs is something that's very important. So if you tell somebody, well, actually, it's better if you have a rest while you're doing your voice therapy, because it's a little bit like dancing on a damaged ankle. A dancer obviously couldn't dance on a damaged ankle, not for too long. So in a way, they're enforced not to do their art. But with singers, often they can do a certain amount of singing, or they can adjust their material or adjust their keys. And so they can find ways round to still perform. The difficulty is there isn't really the dedicated time and space to actually fix the things that need fixing. Any injured muscle needs a bit of time. And so I do advise people who know they've had some issues with their singing voice to seek the specialist help, but try to carve out some time where you can just give yourself the time to work on the exercises, to build in the voice rest, to do all the things that would help the voice get back on track, because very often it is a little bit of time that's needed. Now, in reality, I'm more used to people who kind of have to carry on. And so in those cases, we try and find ways that the person maybe limits the amount of work they take on. And some people will do that and some people won't. But what's of interest is if the diagnosis is something like nodules and the person is singing in exactly the same amount and not really taking on board too much of the advice, I mean, they may be able to do some of the exercises, and that often actually at least helps them not lose their voice and keep enough voice to keep going. But it would be far better if the person also built in the stopping of the gigging for a while, or some of the performances, just to maximize the benefits of the surgery, because in the long run that speeds everything up. Whereas if people just keep carrying on doing what they're doing and doing a little bit of therapy on the side, it's a kind of a sticking plaster, and it keeps them going, but it doesn't really get to the root of the curing of the issue. Like, for example, if it's nodules, you really want to get those nodules down or as small as possible, rather than just learning to sing around them. So I always encourage people to think about that, and if they can take that time, they'll just accelerate the progress with the therapy so much quicker, and at least maybe get to a phase. Often you have to work with performers who've got to get through a certain run of a show or certain gigs that are already booked in, and that's fine. I always try to work around those schedules, but then when there's a time to stop, when the rest is built in, to really go into the therapy at that point and try to get to the bottom of something sooner rather than later, and that will make it addressed more once and for all, rather than always needing to go back to therapy. It's interesting and exciting to see how vocal adjustments that people make can really impact their life for the better. And if you're somebody who needs to earn a living from singing, or who just does it on an amateur level, sometimes for money, sometimes not, but can do more with their voice and not have those doubts, because what happens when the voice isn't working so well is it becomes a little bit less reliable, and that really is a source of concern for people. They're not sure what to do. And if you think about that short-term investment of working on your voice and getting it fixed and getting any swellings and things like that minimized or totally gone, what an impact that would have long-term for you. And these diagnoses do not have to be forever at all. Little swellings and bumps on the vocal cords don't have to be there forever. Sometimes they might be a feature of someone's voice and they adapt the voice accordingly. But being able to work your voice as well as it can be worked, and at least techniques for how to release some of the tensions that build up and some of the issues that build up that make it worse, that would be very helpful to identify in therapy, and to at least be able to rely on those techniques. And hopefully, if you have the space, to work on them on a deeper level and get the voice as fit as possible. If you found the content of the video helpful, don't forget to press the like button and subscribe to the channel.